We know ADEM is more common in children with MOGAD, but are there any relapsing patterns identified for senior adults? What can seniors expect as they age?
It's a great question. So I think that, as was mentioned previously, in adults, the main kinds of relapses that we expect to see are generally transverse myelitis and optic neuritis, especially optic neuritis being the most frequent one. Some studies have suggested that in people with adult onset disease, with relapsing disease, that there may be an association of age with the risk of relapse, and that older individuals, older adults may be at a lower risk for relapse compared to young adults. However, I think more work needs to be done in terms of following up on those findings in larger cohorts. An additional issue that we don't really know as well also is as we age, there is a phenomenon that's called immunosenescence, where our immune systems become less robust as we age, and it is thought that autoimmune diseases in general may become less active with aging. In MOG antibody disease, I'd say it's a bit less clear because it's a recently discovered disease. Our cohort studies have not followed individuals for many decades in order to see kind of how the disease behaves when people get into an advanced age. So that's something that remains to be known. Another feature, additionally, that is quite important is that the recovery from relapses appears to be highly modified by age. So children and young adults can often have a very good recovery following an attack, whereas older individuals may have a poor recovery following attacks. And this has to do to some extent with just the plasticity of the central nervous system and their resilience to injury that has occurred. And so that's something to be aware of, that an attack in somebody of an advanced age or elderly individual may be quite a bit more debilitating than in a younger adult or child.